50% of Americans have prediabetes or type 2 diabetes. Alzheimer's, dementia are going through the roof. 1 in 2 Americans are expected to have cancer in their lifetime.
Meanwhile, in other news, the President of the United States has now named a new nominee for his Surgeon General. That Surgeon General nominee is a person named Casey Means. She replaces another person, Jeanette Nusherat, who had essentially been ousted because of concerns about her views on vaccines. Laura Loomer was a big opponent. Turns out Laura Loomer doesn't like Casey Means very much either. President Trump, for his part, says, listen, this one wasn't me. This is probably Secretary of Health and Human Services, Robert F. Kennedy. Here is President Trump.
Well, because Bobby thought she was fantastic. She's she's a brilliant woman who went through Stanford. And as I understand it, she basically wanted to be an academic as opposed to a surgeon. I think she graduated first in her class at Stanford. And Bobby really thought she was great. I don't know her. I listened to the recommendation of Bobby. I met her yesterday and once before. She's a very outstanding person, a great academic, actually. So I think she'll be great.
Okay, so President Trump, of course, supporting her for this. Casey Means, who is she? Well, she is a Stanford-trained physician. She dropped out of residency. She went to Stanford Medical School. And then she turned into a sort of wellness influencer, author, big pharma whistleblower. She had a bunch of major media appearances, including, of course, Joe Rogan, Andrew Huberman. Here she was, for example, on Joe Rogan talking about what she called the devastating state of American health.
And if you just kind of run through the list of what's happening, it's unbelievable. Like, we are getting destroyed, and it's very recent, and it's accelerating. The stats speak for themselves. You know this very well. 74% of Americans are overweight or obese. 50% now of American adults have type 2 diabetes or prediabetes. These were diseases where there was 1% of Americans in 1950 had type 2 diabetes. Now it's 50% of Americans have prediabetes or type 2 diabetes. Alzheimer's, dementia are going through the roof. Young adult dementias have increased like 3 times since 2012. So early onset dementias, we're seeing, this 1 in 2 Americans are expected to have cancer in their lifetime now. 1 in 2, and young adult cancers are going up 79% in the last 10 years.
Okay, so again, these sorts of concerns are things that Americans are concerned about. They feel like they've been gaslit on American health for a very long time. The reality is that America is obese. America does not exercise enough. America eats junk food a lot. And this is one of the things that Casey Means focuses a lot on, is this sort of holistic explanation of all disease. She says you basically have to stop treating the symptoms, which very often are symptoms of specific diseases, and start treating what she calls the sort of underlying issue. And that underlying issue is supposed to be foundational metabolic cellular health. She says that government policy should focus on things like HDL cholesterol, triglycerides, blood sugar, blood pressure, and waist circumference. Here she was talking about how one of the problems is how doctors basically get paid for treating symptoms, but they don't get really paid for fixing the underlying problem.
One of the biggest problems with the healthcare industry right now is that it's so siloed. We have over 100 different medical and surgical subspecialties. And the business model of American healthcare right now is volume. It's how many people can you see? And so that's what you get paid for. You don't get paid for outcomes, you get paid for volume. And so that has incentivized a structure of healthcare where it's most profitable to actually be seen by as many specialists as humanly possible. And that's what the average American is dealing with. They go to the primary care doctor with a list of issues and they get 8, 10 referrals, and then they spend their life going through revolving doors of these different healthcare offices and not actually really feeling better, and they feel disappointed, and that's why I think people are frustrated. So we've got all these doctors who are incentivized to really be head down in their specialty lane and not actually step out and look at the big picture of how things are connected, when in fact it's all connected.
Okay, now that isn't actually the fault of doctors. Very often, if you're a primary care doctor, if you don't send somebody to a specialist and a disease develops, you get sued. So this is a real problem, is sort of the system of liability and medical liability. It used to be that you had a family doctor. The family doctor would look at you. Most of the time, the family doctor would say, listen, this problem does not require a specialist. Now, doctors, being risk averse, are sending people to specialists more often. All of that is true. She's correct, by the way, that most of the problems that are attributed to sort of disease, if you can treat far earlier the underlying problem with good health, getting exercise, and all the rest, that is going to be a good solution to an enormous number of problems. We'll get to more on this in a moment. First, GoodRanchers.com. They deliver 100% locally sourced American beef, chicken, pork, and more straight to your door, so you don't have to worry about grocery store mystery meat. Their 100% American supply chain also keeps your costs steady and predictable. Get this. The average family throws away about $500 worth of meat every year because of freezer burn, bad packaging. That does not happen with Good Ranchers. Their vacuum sealed, individually wrapped cuts stay fresh for a full year in your freezer. Plus, think about how much meat you usually have to trim off and toss before you even cook with generic grocery store meat. Like 10% minimum, right? Well, Good Ranchers cuts are already perfectly trimmed, so you're actually cooking the stuff that you pay for. Producer Savvy has a very, very chunky toddler. He's a big boy named Mikey. He's extremely cute, and he is huge because of Good Ranchers steak for dinner at least twice a week. That's a little man right there. Better meat, stable prices, less waste. That's just smarter shopping for you and your family. Subscribe right now at GoodRanchers.com and get free meat for life and $40 off with code Ben. Again, that's GoodRanchers.com. Promo code Ben. Get free meat for life and $40 off. Good Ranchers. American meat delivered. Right? She has suggested, for example, that you need to eat fruits and veggies, limit alcohol and drugs, get enough sleep, exercise, avoid environmental toxins. Here she was discussing fighting for life.
Health is the tip of the iceberg of fundamentally like a planetary issue. But like the planetary issue is the tip of the iceberg of what I think is really, really going on here, which is like a spiritual issue. Like we are like not fighting for life in this world anymore. And I think that's more of a consciousness issue. You know, we talk about why is no one covering this? Da-da-da. It's like, I think people see it. I think in some way we have like totally lost respect for like the miraculousness of life. That's what our actions are reflecting. Like, we know a lot. We have the technology, the money, and the resources to fix all of this, the planet and health, and we're not. And that's why I think there's something darker happening on like the consciousness level.
Okay, so she has been called out by now Laura Loomer for supposedly being kind of kooky. The reason that Laura Loomer is going after her is because she put out in her newsletter about when she was looking for romance that she would pray to photos of her ancestors, that she would do full moon ceremonies, that she would talk literally out loud to the trees, plant medicine experience, and all the rest. But the question is, as Surgeon General, are those going to be her recommendations? Or more likely, are her recommendations going to be things like, you know, you should probably eat well and get exercise and get sleep and all the rest? And back in June 2024, NPR, which is no right-wing outlet, published a very long interview with Casey Means, talking specifically about her thesis. And NPR said, Means lays out her thesis for what is wrong in U.S. healthcare in her book, Good Energy, and how patients can take their health into their own hands. She and her co-author, her brother, Callie Means, delineate how common diseases and symptoms that plague Americans are rooted in issues like poor nutrition, lack of movement, and problems with sleep. She says, the most foundational level of health is how our cells get powered. You could have a Ferrari. If it has no gas, it won't run. So good energy is a term to help us understand what we're striving for when we're doing all these dietary and lifestyle investments. Okay, all of this sounds perfectly legitimate to me. Don't really see a major problem, but anything can be turned into a controversy inside the Trump administration. Well, that's all for now, folks. Don't forget to like, subscribe, and comment your thoughts down below. Be sure to check out all of the other great content on my channel. I'll see you here next time.